A headache behind the eyes can come from a number of causes, and it can trigger pain that lasts a few minutes, a few hours, or a few days. These types of headaches are usually a symptom of some other problem or condition that affects the area. To relieve the headache, you first have to identify its cause. Here are some typical causes of a headache behind the eyes. Sinusitis and other infections and conditions that affect the respiratory system can cause a headache behind the eyes, as can a number of other physical disorders. Of course, tumors near the brain are sometimes a factor. But the most common problem is related to vision. For one reason or another, the lens is not able to focus light correctly on the retina, and when this happens, your brain compensates by tightening muscles around your eyes. After a while, these muscles become strained, triggering pain. There are a number of vision problems that are likely to result in discomfort behind the eyeball. Astigmatism. A change in the shape of the cornea distorts the image that lands on the retina. Light rays coming from certain angles do not focus properly, causing hazy vision. People with astigmatism often try to squint. This is a way of forcing the retina to focus differently. Constant squinting overworks the eye muscles, which can cause a headache behind the eyes. Presbyopia. Normally, the lens of your eye is somewhat flexible, but as we get older, we sometimes lose this flexibility. When this happens, we usually have trouble seeing objects that are close to us. This is one of the reasons many people need so-called reading glasses as they age. Once again, the struggle to make the eyes focus properly leads to eye strain, which can result in headaches. Hyperopia. This condition causes the same kind of effect. Images that pass through the lens focus in an area behind the retina. As you try to correct the problem, eye muscles become tired and sore, resulting in pain behind the eyes. General types of headaches. Pain behind the eyes can also be part of a headache that affects the larger part of your head. There are several different categories of headaches that may be factors. Tension. This type of headache causes pain behind the eyes more than any other. Stress, anxiety, fatigue, and lack of sleep can all contribute to a tension headache. Once you reduce your stress levels and get some rest, tension headaches usually go away. Migraine. These headaches, there are a number of different types, are also likely to cause pain behind the eyes. Some migraines can be so severe that they cause a visual aura. You see flashes of light, zigzagging patterns, or even blind spots. Migraine headaches can also cause other sensations, including speech problems, numbness or tingling elsewhere in the body, in addition to pain behind the eyes. A headache can begin in one or both eyes. Cluster. This type can be the most maddening and debilitating of all. Cluster headaches last anywhere from a few minutes to a few hours or even longer. They can occur over and over in the same day and continue for weeks, months, or even years. Cluster headaches often cause your eyes to become red and tear up. After effects include stuffiness and a runny nose. In many instances, headaches result from malfunctioning blood vessels in your brain. These are caused by chemical changes in brain hormones. Getting relief. There are a number of over-the-counter drugs that can relieve a mild headache behind the eyes. If your headache persists for several days, however, it's time to see a doctor. He or she may need to prescribe something stronger. An eye exam may also be in order. Since many headaches come from uncorrected or poorly corrected vision problems, improving your vision may be the key to relieving your headaches. There are a number of therapies that sometimes help, including massage and acupuncture. Rest and freedom from stress can also play a role, since fatigue and anxiety are frequent causes of headache pain.